Hi everyone, Dr. Stephen Huss here from ResourceYourHealth.com. In this video, I want to talk about why the clot or stenosis theory of heart attacks may not be as sound as we think it is. So I wrote about this recently in a blog post. I think I released it maybe 2 days ago. So if you want all the details, go there and read through all the details. But I'm mainly going to talk about this by summarizing the work of a coronary artery pathologist named Dr. Giorgio Beraldi. In his book, The Etiopathogenesis of Coronary Heart Disease, is a great read. It reads kind of like a 150-page research paper, so if you're into that sort of thing, have at it. Be my guest. But I want to talk about 3 studies that he did, that he talks about in his book, among many others, but that really drive things home. So one of the studies, he did autopsies on the hearts of people who died of accidents. So they had no previous heart disease symptoms or diagnosis or anything like that. They just died of an accident, like a car accident or something like that. So he did these autopsies of them, and he found that many of them had clots that were old, that had been there for a while, yet never caused a heart attack, or they had severe stenoses of an artery, yet they had no heart symptoms. That one of the studies said that there was 217 hearts that he looked at in this study, and 171 of them had severe stenosis of the artery. Yet these people had no heart symptoms, and they had no heart attack. And some of them even had a clot that was there blocking, quote unquote, blocking the artery, and there was no sign of ischemia or tissue death or heart attack. The second study I want to talk about is he looked at men who died of heart attacks. These were men in the armed forces. He looked at 432 men that died of a heart attack, and less than 50% of them actually had a clot or a stenosis that was significant enough to cause what is thought to cause heart attacks. And in the 50, or in that 50% of them that did have that clot or stenosis, there was evidence that that clot or stenosis was not the cause of the heart attack, meaning that there was a clot there, but it was in a different area than where the heart attack happened, or it was an old clot that had been there for a long time, and there's no way it could have caused the recent heart attack. So there's lots of different things that made him think that this was not the cause of the heart attack, or proved to him that it wasn't the cause of the heart attack in these men who died of a heart attack. And then the last one is called a plastic cast study, where what he did was he injected the arterial system of the hearts with a plastic material, whether it was neoprene or latex or something, and then he warmed up the plastic material and it hardened, and then he dissolved away the rest of the tissue with hydrochloric acid, and he had this perfect cast of the arterial system of the hearts. And so what he found, one of the interesting things he found, was that anywhere there was a stenosis or narrowing of an artery that was greater than 70%, the body had built a collateral system of arteries around that stenosis to totally bypass it and supply blood to the area that was, being restricted by that stenosis. And he found that everywhere that there was a 70% narrowing, not just in some places, but everywhere. So this explains a little bit why, when we look at the efficacy of bypass surgeries, when they do these large studies looking at the outcomes for people in these bypass surgery groups, that they see little difference between people who didn't have the surgery. They see no reduced risk of heart attacks and no prolonged life in these studies, which I cite in the blog article that I did. So I've talked about in previous blog posts about what does cause a heart attack, and I've kind of outlined what does cause it, because obviously these findings of Beraldi throw doubt into the equation as far as a clot or stenosis theory. And so I've talked a little bit about those in previous blog posts, but I'm going to outline my most detailed explanation of what does cause a heart attack in my next blog post, and I'll talk about it in my my next video that I make, so stay tuned for that. It's probably going to come out in a few days or so. So if you like this video, please like or share it wherever you think people will be interested in hearing it. Otherwise, that's it for now. Stay healthy out there.